Hi, my name is Allison Kirk. I'm a palliative care nurse with Palliative Care in Cleveland County. I want to take just a few minutes today to talk about palliative care. There are so many in the community that don't know about palliative care or what we have to offer. So I want to take just a few minutes to explain what our services are and the role we play in a patient's medical team. So I'll start with how I became interested in palliative care. It piqued my interest in nursing school very early on, and as I went through nursing, I just became more and more interested. And now that I've worked in palliative care for a few years, I want to make sure that the community knows what's available as far as palliative care services. So I'll start with just the basics. What is palliative care? Who benefits from palliative care? So kind of the textbook definition is a healthcare approach that patients benefit from when they have a chronic illness. We focus on quality of life. So for me, that means patients that have a diagnosis that's going to be long-term. Our goal is to focus on their quality of life and what we can do to help them manage their chronic illness. Some of the most common chronic conditions that we see are diagnoses like COPD, congestive heart failure, Alzheimer's, end-stage renal. We see lots of various cancer diagnoses. The list could go on, but that's definitely the most common that we see. And our focus is on managing symptoms for those chronic conditions. So we differ from your regular medical team. We're not going to focus on treating your actual diagnosis. We are going to focus on treating your symptoms. Our providers that do the visits are going to talk to you about what impacts your quality of life, and that's really what we're going to focus on. So if it's shortness of breath, we're going to try to manage your shortness of breath so that you can continue to do the things that you enjoy to do. So that's really what palliative care focuses on. We focus so much on quality of life because we want patients to be able to manage their condition and still enjoy life. So some of the symptoms that we manage include nausea, pain, anxiety, shortness of breath, constipation. Any of those symptoms that prevent you from being able to do what you enjoy doing is what we're going to focus on. Our visits are a little bit different than with your other medical team in that we prefer to visit with patients in the home. Most palliative care visits take place in the home so that patients are comfortable to share information and share their concerns. Chronic conditions are extremely hard to manage. Patients have various treatment plans. The condition itself is really hard to manage depending on what you have. So we are here to try to help support patients and walk with them. We don't ever want patients to feel like they're trying to navigate their condition without support. So the beauty of palliative care is that we can take time to come into your home and you can be transparent with us and share your concerns and frustrations. You know, if you're considering stopping a treatment, we can talk to you about that. Sometimes patients want to stop a treatment because their symptoms are not controlled, and that is the purpose of palliative care, so that we can control that symptom in order for patients to continue their treatment. We really want patients to be compliant with their treatment. We want them to still see their specialist, whether it's an oncologist or a pulmonologist, cardiologist. We want you to still continue with treatments. So palliative care is here to help support patients so that they're successful and still have a quality of life despite their chronic conditions. We also, most palliative care programs, and ours as well, has a social worker that focuses on making sure you have the resources needed to be successful. It's very important for patients that have a chronic condition to have a health care power of attorney in place. And so social workers can help put that in place for you. We want you to have a plan. That plan can change, but we will also want you to designate someone that can follow through with that plan, even if the plan changes. If you are unable to make that decision, you need to have someone in place if you have a chronic condition. So our social worker is available to help do that, as well as provide some connections with community resources if needed. So those are some of the highlights of palliative care. Palliative care is an added resource to your medical team. We're not going to take away any providers. We are here to help support you so that you can continue your medical journey with each provider that you have. So we are really here just to be supportive. We have a team that's available, our providers, our social worker, nursing staff, to help support you guys so that you can continue on your journey with a chronic condition. If there's anything that you have questions about, reach out to your specialist and your primary care providers. They're a huge resource when it comes to knowing whether or not palliative care is appropriate. They know how to get referrals to palliative care, so please contact them. We also, through Palliative Care in Cleveland County, can provide guidance and information on whether or not a patient meets the criteria for palliative care. So please feel free to contact us. Our information is on our website. And so I want to thank you for your time today. I hope that you have a better knowledge of palliative care, and please feel free to call if you have any further questions. Thank you.